How's it going? My name is Matt and I'll be your nurse today. Let me just clean my hands off here. All right, and your name is Neonatal?
Yes, that's me.
Perfect. And can you just confirm your date of birth for me, please?
March 15th, 1989.
All right, thank you for that, Malia. And so how are you feeling today? I was actually just down in the lab, saw your test results, and you have some abnormal blood sugar findings. They're a little elevated.
I'm just nervous about all this I've been hearing about gestational diabetes and what that means for my baby.
So I'm going to be discussing a lot of issues and topics, so if you have any questions, just feel free to jump in. Don't mind me. I'll be asking you a few questions just to iterate some important topics at the end, but first I just want to hear what you know about gestational diabetes, and then we can fill in the blanks and hopefully clarify a few things for you.
No, I don't think so.
And so do you know which way you learn best? Because we have a lot of topics and concerns to cover today, and I just want to make sure that you are able to retain and understand all the information that we go over today.
I think I just prefer to listen and take it all in.
So gestational diabetes is diabetes that you develop during the course of a pregnancy. It's typically diagnosed in the second or third trimester of pregnancy, and its risk factors include physical inactivity, obesity, hypertension, pregestational diabetes, high-risk ethnicity, and smoking. And so because you are of indigenous American descent and overweight, you are at risk of developing gestational diabetes.
Oh wow, I didn't know those risk factors. Is there anything I can do?
Yes, unfortunately, there are a lot of things that contribute to the development of gestational diabetes. However, there are some lifestyle modifications that you can do to help manage gestational diabetes. So you can participate in regular exercise or activity. You can modify your diet by adding more fruits, vegetables, whole grains, and reduce the amounts of red processed meat, refined grains, and high-fat dairy products. You should refrain from smoking or participating in recreational drug use. And furthermore, we can also discuss anti-hyperglycemic medications with your doctor if your lifestyle modification is not working. And there are, of course, some things that cannot be changed, unfortunately, like race and ethnicity, age, gender, but making even small changes to your lifestyle really can help.
Okay, I can definitely change up my diet. I have been eating a lot of red meats lately. I can also add more exercise into my daily schedule. I want to do what's best for my baby.
Great! Those are fantastic changes you can make to manage your glucose levels.
And how will this affect my baby?
You know what? That is a great question. Enough people don't ask that question. But you know what? There are a few risks involved with mothers that have gestational diabetes and the newborn. And one of those issues is neonatal hypoglycemia, and I'd love to discuss that further with you.
Okay, thank you. Is hypoglycemia low blood sugar?
Yes, you are correct. So neonatal hypoglycemia is when the newborn has lower levels of blood sugar. So risk factors for gestational diabetes that poses on the newborn are hypoglycemia, preterm birth, or the newborn being small for gestational age. So newborns that are small for gestational age or are preterm are especially susceptible to hypoglycemia due to their bodies being immature and not able to control glucose properly. These preterm newborns are also prone to respiratory distress and hypothermia, and either or both of these can lead to hypoglycemia.
Oh my goodness. Is there anything I can do if my baby ends up being diagnosed with hypoglycemia?
Absolutely. There are several ways that we can help your newborn in the initial hours after birth if it does show signs of neonatal hypoglycemia. So first and foremost, newborns that are diagnosed with this will be monitored closely and may be subject to frequent glucose monitoring. And I also want to share a few of the symptoms of hypoglycemia that you can identify them yourself, either here in the hospital or after you take the baby home, okay?
Okay.
All right, so a few of the main symptoms that your baby may experience if he or she is experiencing neonatal hypoglycemia. They could become jittery, could have decreased muscle tone, experience changes in level of consciousness. They could become blue from poor circulation or respiratory distress, breathing rapidly, have a hard time with feedings, develop hypothermia, or experience seizures. Okay, And now if any of these things do happen while you're in the hospital, we'd like for you to tell your nurse immediately. And if you are at home, to head straight to the emergency room, okay?
That seems scary.
Honestly, yes, I know. A lot of this can be very, very scary, and it can be a very difficult thing to deal with. But the more prepared you are, the more prepared you are to deal with those difficult situations. And so it's important to discuss these symptoms with you now so that you can identify them later on if they do occur. And I'll also be sending you home with a pamphlet that will show you some of the information that we discussed today and some of the signs and symptoms, so you don't have to memorize it. You'll be fine, okay?
Thank you. This is a lot of information, but I'm happy that I know it now and I'm not underprepared later on.
Okay, so as we discussed previously, I'm going to ask you just a few questions just to make sure you retain some of the information that we talked about today, okay?
Great.
All right. So what are some risk factors for gestational diabetes that you can change and some that you cannot?
I know I can't change my race, but I can add more fruits and vegetables into my diet, and I can exercise more.
All right, good job. Good job, well done. So can you tell me what hypoglycemia is and some of the risk factors associated with it?
Hypoglycemia is low blood sugar levels. It can develop in a newborn if the mother has gestational diabetes or if the baby is born too early. It can also develop in babies who are too cold or babies that are having a difficult time breathing.
Oh my gosh, you are doing so wonderfully, phenomenally well. So I just have a couple more for you though. So what are some of the ways you can identify if your neonate has hypoglycemia, and what should you do?
I remember you saying they could have a hard time with feedings, become jittery, or even become blue. And if that happens, then I need to call my nurse immediately, or if I'm home already, then I need to take my baby to the emergency room.
Yes. Do you have any other questions for me today though? I just wanted to make sure that there's nothing that we haven't touched upon today.
Not right now.
All right, great. Well, I'm glad we had this discussion today. And if you have any other questions, please call the office. I'm going to send you home with this pamphlet right here. Fancy schmancy little pamphlet that my coworker Sara made.
I'll be sure to review this.
All right, you're welcome. Take care. Thanks for coming in.